Case tooth number 31, I call this nightmare access. The lower second molar in a patient who did not open very wide. He had significant bone loss on the distal of tooth number 30. So this was a deep site, and his molars were set back in his jaw. So this was a very, very difficult placement. We used a pilot hole guide in this case, and we used a ThinLayer guide. We prepared a pilot hole, and you can see how tight the space was. This poor patient was really cranking to keep his mouth open, so I could barely get in there. And then we did an angled entry, and again, even with the angled entry, it's a squeeze, and then we had him stretch so I could get in vertically. Here you get some sense of the implant placement, the implant position, from the occlusal view and from the buccal. And finally, the case, this is the implant position clinically, and here's the implant position radiographically. I think we all know that there's no way you could do this with a tube guide. So the situation is such that either you do it freehand, or in this case, I was fortunate enough to have this guide.